Today we'll be talking about the acute effects and perception of deep oscillation therapy for improving hamstring flexibility. Hamstring injuries have been shown to be increased with previous injury or inflexibility. And today we'll be using deep oscillation therapy, or DOT, which is a manual therapy in which frequencies are bounced between patient and clinician, creating a magnetic force between electrodes, which causes vibrations and increases lymphatic fluid flow within the patient, which then can decrease pain. The purpose of today's study is to determine the DOT's effectiveness in hamstring flexibility and patient perception. They used 29 individuals and tested hamstring flexibility using a digital inclinometer. The hamstring flexibility was tested with hip and knee movement, and 3 measures were done both pre and post DOT. The DOT was used as Hibamat, and before using the DOT, hamstring flexibility was measured. They were supine for 3 minutes, and then the DOT procedure was performed. This allowed us to get a baseline. And then in order to determine patient perception, they used Copenhagen HAGOS, which is Hip and Groin Outcome Score, which is a self-reported tool to identify pain and function, as well as the Croc scale. Results were shown for HAGOS and hamstring flexion in the tables here. The HAGOS scale basically presents as 100 was no problem at all, and 0 presented a big problem. So as you can see, all scores were close to or above 90. The conclusions from this were that there are possibilities in improving hamstring flexibility in a healthy population by using DOT. However, this may be due to a decrease in the mechanoreceptor excitability, but this was not tested in the study. It also showed that participants did feel somewhat better in regard to their flexibility post-DOT treatment. This study shows that DOT may be an effective modality in increasing hamstring flexibility in the future. My critiques are that there was no direct comparison with DOT in 2 other modalities, as well as these were all done in 29 healthy participants, when they could be using this on injured tissue. For future studies, I would compare DOT directly to ultrasound, massage, e-stim, etc., or even use them in conjunction with these to see how those can further improve our flexibility in the hamstring. I would also like to test specifically injured tissues, both hamstring strains and other injuries that may affect hip extension and knee flexion. And my references.